Okay guys, here's the story. When it's time to flush that liver and gallbladder system out, this is the story how to do it. And I've told this story for almost 30 years. I've done it many different ways, but I'm gonna show you the most valuable way you can do it. And what I mean value is because your liver has value. It's one of the most important besides your heart organs in the body. Some call it like the lizard tail because a lizard can lose its tail and regrow it. Your liver is one organ in the body that can actually regrow itself. So to help it replenish itself and recover from all the chemicals, poisons, hormones, stress you put into the body, I'm going to show you a very easy liver flush. So many of you know about, if you've been with me especially, you know about the oxy powder. Oxy powder is one of the only products that still works the proper way of releasing the saturated singlet oxygen into the body to help clean out the biofilm. Biofilm is that mucoid layer you have in the body. And so with biofilm, it's not just in your intestines, you get this all over the body. And this is the home of the yeast and mold. So I would do 1 day, 2 days, or if you want to do it the real way that I actually do it, every patient does 1 week of cleaning with oxy powder first. That is the initial step to prepare your liver for what's coming next. Next, we have Colaplex and we have Chenkopiedra straight from the rainforest. These two are next needed. Let's say you do a week of the oxy, then you're ready for your liver flush week. You'll start, and for 4 days, you're gonna do each one of these products. These are all on our site on kiessentials.com, ki-essentials.com. You can purchase your kits, guys. So we have it all prepared for you. Colaplex is very good at doing one thing. That bile we have in the body gets thick in the gallbladder, and so the thickness of the bile can get kind of clogged up. So Colaplex is very good at doing a ½ an ounce every day for 4 days to help thin the bile. And then you're taking the Chenkopiedra at the same time, which is known as the stone breaker, which is a liver detoxifier, but also it's very good for breaking up the calcium. And we all have this excess calcium all over our body. If you're getting kind of stiff in your body and wondering why it's just getting older, thinking why you're getting so stiff, it's not just getting older. You have accumulated lots of calcium in all the wrong areas. It gets into your soft tissues. These two together, a ½ an ounce, these are 2 ounce bottles, so you take a ½ an ounce every day for 4 days, and you're preparing the liver and gallbladder ready to dump its toxins. So let's say you did your 4 days. On your 4th day evening, let's say this is Friday night, you take the Liver Health 2 ounce bottle and drink down half the bottle. And you don't need to dilute this, guys. You can just dump it down the hatch and drink it down. It tastes good. So that Friday night, you're gonna drink half the bottle. So once you get this particular part of the kit done, then you're gonna wake up and here it is Saturday morning. This is your fasting day. What you're gonna do is take Himalayan sea salt. I have a little bit of the pink salt here. You take the Himalayan sea salt and put it in water, or you put the rocks in the water, however you decide to do it, and you drink a little bit of the salt water all during the day. And this is gonna help you with the hunger pains. So Himalayan salt in your water all during the day, and you are fasting. You're not gonna die, I promise you're gonna be okay. All right, so when you get to fasting all day, you're gonna get to 5 o'clock. And at 5 o'clock, what are you gonna do? Well, I'm gonna take out this salt. Notice I wrote salt on the bottle, all right? But what you're gonna get, you're actually gonna get Epsom salt. Just regular old Epsom salt from the store. You're gonna take a tablespoon, a level tablespoon of Epsom salt, and you're gonna dump it in a glass, like a coffee cup like this. And I would put in there a ½ a cup, maybe not even a half, of warm water, and get it warm. And when you put that Epsom salt in there, stir it around, and what you're gonna help it dissolve. Just like the old days, I know my grandparents did, they used to drink Epsom salt to help loosen the bowels. It was for constipation. Epsom salt has lots of magnesium. And that little duct you have between your gallbladder and the liver gets stuck, right? And so that little duct is constricted. When you drink Epsom salt, it has lots of magnesium. It helps dilate that duct so the stones can actually come out of the gallbladder and release into your body. And those stones are what? They're calcium and phosphorus. Those are the two things that have accumulated, all this excess calcium. So 5 o'clock comes that afternoon. You take this around, you stir it around. Drink it quickly while it's warm. Drink the Epsom salt. Of course, it tastes salty. Have a wedge of orange. Suck on that piece of orange, and that's gonna take that salt flavor right away. That's at 5 o'clock. Now, you may find yourself in the bathroom for a little while, 30 minutes, 45 minutes later, from loose bowels. You may or may not. At 7 o'clock, you're gonna do the same thing again. Get that nice little cup, get your tablespoon of Epsom salt, dump it in here, stir it around, and drink down that warm Epsom salt water. Once again, have that wedge of orange, suck on it, that takes the flavor away, and you've completed that cycle. So 5 o'clock, 7 o'clock, you do the salt, Epsom salt and water. All right, let's put that away. And then here comes 9 o'clock. This is go time. 9 o'clock, good old olive oil. Now, it doesn't matter what brand. I go to the store and I lean test, like muscle testing, I lean test which bottle I need for flushing. I'm going to use this cup as a reference again. You're going to take this olive oil and pour in here 3/4 of a cup. Measure it out, 3/4 of a cup of olive oil. And then 10 minutes before you're going to drink this, like around 9 o'clock, here it comes, it's olive oil time. You're going to put this in the fridge and get it chilled. And don't leave olive oil in there too long, it'll start to gel, it'll start to get harder, right? And so chilled olive oil goes down the palate much easier than regular olive oil. So once you have this olive oil in here, you're also going to get ahead of time either grapefruits, lemons, or oranges, and my favorite is oranges. Fresh squeeze them yourself and get ready, because now you've got this olive oil ready to go down the hatch. You're going to pour in there another 1/4 cup of juice alone. So that's going to give you a full cup of olive oil and juice, right? Now, I don't have a straw with me right now, but I'm going to pretend this is my straw, okay? Those good old smoothie straws are my favorite. Some people drink it straight. So I've got the 3/4 cup of oil, a 1/4 cup of juice. I take the straw, and I stir it around, lean over it, and just suck that oil down. Now, my little trick is this. Along the way, when I'm sucking down the oil, the juice will disappear. I take a little more of that orange juice I have left over on the side and dump a little extra juice and finish sucking it down. What do? Put it to the side. Don't even clean up. Go lay down on your right side, the side of your liver, pull your knees to your chest, and for 30 minutes, don't move. Just lay there. Let that oil go all through your body. Olive oil is the one oil that will go in there and like glue, it'll grab all these chemicals and other toxins and pull them out of the liver. You're trying to clean out that liver gallbladder system. It also, liver has the gallbladder, which has the bile, which is for breaking down fats. So the bile that's in that gallbladder is a reserve because your liver makes the bile, but the bile salts breaking down fats. So what is olive oil? Olive oil is a fat. So you've been fasting all day, you've held up that bile in that gallbladder. So when you drink down a bunch of that olive oil, 3/4 of a cup at a time, the reason you drink that much is going to make your gallbladder spit out all that juice in there, all those bile salts that's been circulating and being reabsorbed in your body over 9 times. So when bile is absorbed out of the small intestines 9 times, it becomes very toxic. So drinking this oil with the juice is going to help empty this and spit the rest of it out of the body. It also cleans out the liver. Now, also, olive oil is one oil that will do one special thing. It helps create oxygen in the body. So it goes to all the tissues of your body, not just your liver. This is going to go into the kidneys and all through the body, the olive oil. So now that you've done this at 9 o'clock, 30 minutes later, get up, walk around. You have any nausea, get some ginger tea, some peppermint tea. Get the essential oil peppermint, put it on the back of your tongue. Your first time you do this, you may have some nausea because there's where all the toxins are. They're loaded in your liver, especially your toxic bile, right? So once you do this, go to bed this evening. In the morning, as soon as you get up, take your good old friend, the Oxy again, and do your 6 to 8 Oxy in the morning. This is going to help continue your flush. But once you've done the oil of that evening, guys, the hardest part is done. And this is literally the hardest procedure I ever ask patients to do, is to perform this liver and gallbladder flush. But let me tell you why. After 30 years in practice, this is the most beneficial, most important thing you can do to your body. You have a lung issue, it's your liver. You have kidney issues, it's your liver. Whatever issues any organs of the bodies are having, guys, it all goes back to the liver. You must clean your liver and gall. You say, well, Dr. Price, I don't have a gallbladder. Well, your gallbladder being gone, you don't have the bile salts, you're having trouble breaking down fats. But also, your liver is now having to work twice as hard. So you, especially without a gallbladder, must do these. Now, how often should you do these flushes, guys? When I have a new patient, twice a month. Twice a month until you get to what? 6. 6 flushes are necessary to really get a better liver and gallbladder system. Some people take 8 or 10. We're talking about people who have autoimmune disease, cancer, things like this. When they flush your liver, guys, usually about that 3rd flush, somewhere in there, that begin to see the light of day again, that begin to get their energy back. Because that brain fog you're having, those gut issues you're having, all stem from this area. And to get your digestion better is to clean the liver and gallbladder system. So cleaning the colon is number one. Cleaning the liver and gallbladder system is number two. Guys, this is the most important thing you could ever do. And I promise you, when you do these, you're gonna feel tons better. But do get some advice. Many people are gonna tell you many different ways to do it. And I've got about 5 different ways that I do this cleanse. Once you do this one, I've got ones that are actually easier to do. And then once you get to your 6, maybe more, all you do is maintain them. This is how I've maintained my health for all these years, guys. For my health, to have a recent injury and stuff, olive oil flushes, guys. Epsom salt, olive oil, they are essential. I'm Dr. Price. You guys have a wonderful day. Get your olive oil, get your salt, buy the kit, and get moving.